Some of you may have heard about Charcot foot, which is spelled C-H-A-R-C-O-T. It is a condition that affects primarily diabetics, but can actually affect anybody with neuropathy or nerve damage and adequate blood flow. It requires both conditions to be present. Alcoholics are also commonly affected, but the condition is most commonly associated with diabetes. What the condition is a softening of the bone structures in your foot. It occurs from mild trauma, mild repetitive trauma in most cases. It can also occur from an abrupt trauma. What ends up happening is the typical balance of bone remodeling that occurs in your foot between bone buildup and bone breakdown is altered to the point where the bone breakdown process overwhelms the bone buildup process and the bones become soft, almost like a putty. And so you can imagine what happens if you walk on a foot made of putty. The foot crushes and collapses on itself. It only occurs in about 15% of diabetics, but when it occurs, it can actually be a very serious condition and actually can result in amputation in some cases. One of the first hallmark signs of it that you see when you look at your foot on your daily inspection is that your foot may become warmer or more swollen without any sort of wound present throughout the foot. If this occurs, it could possibly be cellulitis or infection in the skin, but you should always keep in the back of your mind that it also might be Charcot. You should immediately check with your doctor or your podiatrist and be seen to evaluate for this. One of the precautions you can take if you think it might be a Charcot change taking place is to immediately take the weight off the foot, potentially even using crutches. As the bone softens, if you offload the foot or take the pressure off the foot adequately, nothing bad will happen. The Charcot will then proceed through its stages, and the stages are first the inflammation you see with the redness and swelling. Second, it goes through a remodeling type phase where that bone becomes regular bone again, and then it goes on to what's called a consolidation phase, which is when the Charcot becomes regular bone again and you can begin to apply pressure on this. So take the precaution and take the weight off your foot, because if it turns out that it actually is a cellulitis, you haven't affected the treatment plan for that at all. And follow up with your doctor very, very urgently.